Here at the Sickle Cell Foundation Nigeria, Mrs. Ayo Otaigbe is a genetic counselor, and she shares her insight into how to live healthy with sickle cell disorder.
We don't do directive counseling, we do non-directive. It helps the clients to make their informed decisions. Those who are affected, it makes them to know what to do to keep well, make them to know what to avoid. Even when they are having their crisis, where to go, when to go, who to meet, places to go. And we also teach them to recognize some signs and symptoms. For example, like when is a child anemic? How do you know that a child is anemic? We teach them what to recognize. When a child is very pale, the eyes are pale, the hands are pale. The child, if he walks a little distance, is breathless, and is weak, very weak, you know it's an emergency. So we teach them complications, emergencies, and also like little children, they have something we call splenic sequestration. When the blood that should be flowing the whole system is entrapped in the spleen. We teach parents how to palpate the spleen every day. It's a sudden feeling enlargement of the spleen. So it has helped to save a lot of children.
What do you tell parents when it comes to the triggers of this sickle cell crisis, and what to do if they notice some of the signs?
The trigger factors, first of all, we teach them that extreme cold weather can make a child have crisis. When cold enters them, can trigger of pain. They may be coughing, may have a catarrh. An infection can enter, you know, their body cannot fight any infection. It can be descend to chest infection, even to pneumonia. And cold weather, they must clothe the child properly, wear thick jackets or cardigans. During hot weather too, the weather is very hot, it can trigger crisis. So we teach them to dress to suit the weather. They can wear cotton materials that will make the child not to sweat, or the adult not to sweat too much. If they must walk under the sun, it must not be for too long. If they are waiting for a bus or for a taxi or anything, they can stay under a shady area or use an umbrella to shade themselves or the children from being beaten by, you know, hot sun can dry the skin too. So if they are in a stuffy environment where there is no enough ventilation, because it's when the cell lacks oxygen, that is when it changes to sickle shape. So if they are in a stuffy environment, no enough ventilation, no enough oxygen, that they are there for a long time, it can trigger crisis. They must make sure their windows are open. You know, some they say because of, and then, you know, in Nigeria we teach them because of mosquito to put nets on windows and doors, but some still tend to lock their doors and windows and all, and say, oh, they don't want mosquito to enter. So we tell them to make sure their windows are always open every time to allow in enough fresh air, enough oxygen. If they have crisis, it depends on the type of crisis. You know, there are different types of crisis. There's anemia crisis, there's a boob pain or painful crisis. If it's anemia crisis, I've already said it's an emergency if you see they are pale. But if it's pain, we teach them that they can put small towel in hot water and do hot fermentation. Apply to the area there is pain and use balm and give pain relief medicine. They can start from paracetamol. If it's not effective, they can use ibuprofen. At times when they give ibuprofen, can be taken every 8 hours, but in between they can also give paracetamol in addition. But if they watch this child within, I always tell them, we say within 24 hours, it's not relieved. This child should be taken to see the doctor. But I tell them it's not always you wait for 24 hours. If you have given this drug twice and the child is still screaming, even if it's within 12 hours, please take this child to see the doctor. And when they get the doctor, we know what to do. And you know, we also tell them about malaria. Malaria is like a double-edged sword. It breaks down the red blood cell. People also have aches and pains, if you're other people, when they have malaria.
If sickle cell is left unmanaged, what could be the complications?
with good management, we also like to catch them young. When they are very young, the parents who know they are both ASAS check their child within the first year, and they refer them for counseling, and they know the clinics to register, to be going to regular clinics, not ad hoc basis when the child is sick before you go and see doctor. When they go regularly to these dedicated sickle cell clinics where there are experts to look after them, you see them doing well, because if anything is happening, it's quickly detected when they examine them, and they treat it on time before it's a complication sets in, because sickle cell affects all organs. Any organ blood gets to, it affects all the organs in the body. So when they are treated well, that is why today those who have access to good health care delivery or healthcare services, they are living well. They cannot live to adult old age. But there are times, even if you do everything, you know you have done everything, somebody goes, you know it's not your fault, but something that should be prevented. It's not prevented because of ignorance, because of where to go to, ignorance of what to do, or poverty, or no access to good health care, and somebody dies. It's always painful. As I said earlier, you know, like that anemia now, if they take their regular drugs, they eat balanced diet, anemia could be, they take their malaria preventive medicine, like paludrin, because malaria is one of those that can cause severe anemia. You see them, they do well when they do this one. Then when they go to the clinic, I mean the hospital promptly, like when they are having pain, as I said earlier.
But if they don't go, that's
if
what
they
I'm
don't,
saying.
if they don't go when they have like that splenic sequestration, if they don't move on time when they have that, if they don't know they are receiving anything called that splenic enlargement, the child can die suddenly from that complication of splenic enlargement. Like some of them limp, hip avascular necrosis, when the head of the femur, the bone of the thigh, when there's no blood supply, it can die. Let me use that common language. And you see them limping. If they recognize the pain there, one 37-year-old was referred here for counseling, was limping already. He said for a whole year was in pain. He was just swallowing Panadol, ibuprofen, Panadol. If he had known and he had come here, what we do, we quickly refer them to the orthopedic doctor, who will quickly treat them before the complication result, that complication of limping and all that. That bone can be saved if it's promptly treated. So that is one of the complications. There are other complications. When they go to clinic regularly, they check. Every year they should check their eyes, especially those with hemoglobin SC. They are prone to eye disorder. If they don't know, if they are complaining of eye weeping, something, before you know it, they get blind. But when they have access to genetic counseling, we teach them. When they come here, they complain, we refer them to ophthalmologists. That eye is saved. And also kidney. They check their urine. They do. They check their kidney, because it can affect the kidney, can affect the heart. When they attend the clinic regularly, all this can be detected. The heart is going to be affected, or the kidney is going to be affected, or the bone is going to be affected, or the eyes are going to be affected. So all this one can be prevented as much as possible.